At the Saint-Jerôme Hospital, some staff say crowded conditions have led to serious problems, including in the emergency room.
You have a COVID patient, and the only thing separating him from the other patient, he's about 4 or 5 feet away, is just a curtain, and the patient's coughing his lungs out, but he's right next to another patient.
The Regional Health Authority confirms since the pandemic began, more than 80 people have died after catching COVID-19 at the hospital. Some doctors are urging their patients to leave the facility as soon as possible after certain surgeries. Because the longer they stay, says Dr. Yen Liu, the greater the risk of contracting COVID or something else. The problem, staff say, is an aging hospital too small for the growing population it serves. The Regional Health Authority denies mixing infected patients with those who have tested negative and says of the 8 units with recent outbreaks, all but 2 are now under control.
Ce dossier-là, il est encore une priorité.
Quebec's Health Minister Christian Dubé says the problems at the hospital are a priority. A temporary wing is in the works that will add 57 beds, but it won't be ready until January. And a permanent upgrade is more than 8 years from completion.
That's definitely an hospital that hasn't been able to control their own outbreaks.
Dr. Gilbert Boucher worries the situation in Saint-Jerôme could play out in other hospitals if ERs get crowded in January.
We've seen it in the previous years. Coming back from the holiday season, the emergencies are full, the hospitals are crowded, and then we need to put people in corridors, and we cannot do that with COVID.
But in Saint-Jerôme, some staff say they have no choice until more beds are available. Alison Northcott, CBC News, Montreal.